So mid-procedure, the doctor and the nurse just like stopped.
As soon as he made that incision, he said, yeah, this is not a cyst.
What looked like a cyst was really a tumor. Coming up, the rare diagnosis that paused this young athlete's football career, but only temporarily. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. When Hayden Carroll is reading the defense and staring down a blitz, the college quarterback knows he can endure it. Alexis Del Cid shows us this young man has already, though, endured something much, much tougher.
Range of motion was a little wacky at first.
That thing was flying great.
If you've never seen a perfect scar, it's because you haven't met Hayden Carroll yet, a football player with a football-shaped scar.
It's been definitely a curvy road for me. Overcoming adversity is a big thing in football. You're going to have down days, and it's just about how you bounce back with it.
Hayden never could have foreseen how much he'd need that skill.
One day I was going to take a shower, and I was like, this isn't usually here.
It was June of 2023. Hayden had just started junior college in California with hopes of earning a football scholarship to a 4-year university when he noticed a small, hard lump on his upper left arm. He called his parents back in Jefferson City.
At that point, I'm thinking, it's probably nothing. What is the likelihood of this super healthy, athletic 18-year-old having something that is, could change his whole life on his arm?
His mom and dad flew him home to see a family doctor who looked at it, felt it, and said it was just a cyst. They scheduled a procedure to remove it. Hayden was awake with local anesthetic. His mom was in the room.
Mid-procedure, the doctor and the nurse just like stopped. And they're like, this is not a cyst.
As soon as he made that incision, he said, yeah, this is not a cyst.
And they said, we're gonna go ahead, we've already started.
The doctor kept cutting, and the follow-up call after lab testing was devastating. It was a spindle cell tumor, cancer in his arm.
They told us not to look into Google too hard.
Of course, like most of us, they went straight to Google.
It's very rare. The stories that you can find out there are terrifying.
And they were further devastated to learn that cutting into it was one of the worst things that doctor could have done because it could have spread the cancer cells.
I'm not handling it well. Of course, you think the worst.
We were blaming ourselves for letting him get into that situation and letting him have that initial procedure.
We didn't know that there was any harm by making it cut. That makes it worse by spreading those cancer cells.
They switched Hayden's care to the University of Kansas Cancer Center, where they met Dr. Benjamin Powers and Dr. Howard Rosenthal.
Dr. Powers and Dr. Rosenthal, I feel like they have been just like, angels from God.
What was meant to be a single week home turned into months away from school and football. And after a second, more extensive surgery,
Dr. Powers had looked at him and said, hey, you're cancer-free.
Hayden's story could have ended happily there, but Hayden had other plans.
Asked Hayden, he was like, what are you gonna do now with your life? And he was very adamant of, I'm gonna go back and play football.
The new battle, how to make that possible.
It was a big question mark.
After missing so much football for such a serious reason, Hayden wondered if any team would want him.
Yeah, I don't know if any of the schools are really gonna want a quarterback that had cancer.
What happened next is something you might think could only happen in the movies. His dad drove out to California to help Hayden pack up his life with a somewhat nutty idea.
It was a long shot.
On their drive back to the Midwest, they would just stop by every college Hayden liked and see if there was a spot on the team for him.
As a parent, I want to teach him to never give up on something.
Like, is that really realistic? You're just gonna show up and what if they're busy or what if they're not there? Don't you make an appointment?
One, we showed up and I remember they were completely locked. We weren't getting in.
After several stops, they arrived at Southwestern Oklahoma State University.
We showed up, started looking around the school, and was like, hey, is Coach Rice here?
I knew absolutely nothing about Hayden before meeting him. That was one of the easiest recruiting trips we had.
A handshake with the head football coach, Andrew Rice, turned into an entire day and then a revelation.
I've kind of viewed it as a tool in his toolbox. This is somebody I'm going to be able to really push because he's already overcome something that's far bigger than just the game of football, and he can throw the ball.
Hayden landed that QB spot on the team, and a few months later, Hayden had his own revelation. He's grateful, not just for the opportunity, but also for the cancer that led him to this point.
I don't know how I couldn't be grateful for it. It's been my entire life playing football. It helped remind me of why I do it and why I love it.
And we are so happy to have Hayden and his parents, Jay and Emily, with us in studio this morning. How are you all doing?
Good.
Great.
Good. Jay, I know it's still emotional for you, and watching that story unfold in front of you, what's that like?
Yeah, I'm just proud of him.
You
really
should
am.
be.
Yeah.
Should be. We are also connecting this morning with Hayden's head coach, Andrew Rice, with the Southwestern Oklahoma State University Bulldogs. So glad to have you with us, Coach.
Good morning. Glad to be here.
Good to have you, as well as we have Dr. Howard Rosenthal, Hayden's surgeon and an orthopedic oncologist working at the Sarcoma Center at the University of Kansas Cancer Center. Dr. Rosenthal, so great to see you, and how great is it to see Hayden doing so well?
It makes me very proud, and I say all the time, my patients inspire me with the accomplishments that they do, especially Hayden facing such a rare and unusual type of cancer. That would affect his life, obviously, but also affect what he wants to do in that life.
And Coach Rice, I mean, such an impressive young man, to say the least, right?
Yeah, absolutely. What he's overcome and what he's done to get to this point in his life is really remarkable and really inspiring.
Well, we will talk with you more here in just a moment. But Dr. Rosenthal, Hayden did the right thing when he felt that lump. He didn't just ignore it. He went to see his doctor. But that original provider assumed it was just a cyst. What are the similarities, though, between just maybe a run-of-the-mill cyst and what turned out to be a life-threatening tumor?
So the greatest problem with regard to sarcomas representing a group of cancers, typically of musculoskeletal system, is the recognition of that problem. And as you just alluded to, most bumps on the body are cysts or lipomas, and there are no other symptoms or blood tests or anything else that's going to give us a clue. There are no risk factors. So the problem is people just have to recognize that they do exist. And if there's anything unusual about, certainly if they grow, they need to seek the attention of their physician.
Tell us more about Hayden's diagnosis. What is spindle cell sarcoma?
So the name of the tumor is descriptive. So spindle cell tumor or spindle cell sarcoma is just a description of the cells themselves. They're shaped like spindles. The name of his tumor is really an undifferentiated pleomorphic sarcoma, or UPS, which is essentially just describing that it's made up of very unusual cells. What's more unusual in Hayden's case is his age. This is a diagnosis typically seen in the 5th, 6th decade of life. It is a sarcoma, which makes it extremely rare. But of those rarities, we see a fair amount of these. And one has to be aware of them and treat them in the appropriate manner, that being surgically ridding the patient of every last sarcoma cell.
Hayden, Jay, Emily, hearing the word cancer, very scary. How did you react to that initial diagnosis? Mom, I'll start with you.
Oh, hearing those words, I think at that moment, it's just the fight in me kicked in. I was like, we're gonna fight this, we're gonna find the right care, and we're gonna beat it.
Jay, what was it like for you?
Initially devastating, just heartbreaking to a young man like him. But, she picked me up too. And so, we went after it, we fought it, and nothing was going to stop us. And that was the best example we could do and lead by for him.
Hayden, you were 18 years old. What was going through your mind at the time?
Really, I was kind of just confused and lost, really. They said, you have cancer, and I just kind of sat there because I was like, you hear about this stuff, but you never really expect it to happen to you. And to their point, she was making calls to cancer centers everywhere, and yeah, they were just in shambles, and I was just like, how does this even happen?
Yeah, I would imagine you start looking for answers. How did you as a family decide to come to the University of Kansas Cancer Center?
We went to a couple different places to try to weigh our options and figure out what the correct thing to do was. But KU was the only place that we came to that allowed us to have options. Every other place that we went to said, this is what we need to do, and KU said, we have 2 different options. We can save the radiation for after the procedure in case it comes back, and that was really weighing to me because it gave me an option in the future.
You know what I love is that I asked that question and I looked at your parents thinking they were going to jump in and answer that, and you jumped in and answered that question as to why you came here.
Sorry,
I love that. I love that. You're the patient and you had that answer, and that is perfect. So I'll ask Mom and Dad then, what was the impression you had when you came here with the staff and when you met with Dr. Powers, Dr. Rosenthal, and the people who were going to be caring for your son?
Yeah, the optimism, first and foremost, and the care between Dr. Powers and Dr. Rosenthal. They just, you could really tell a difference here. Everybody was on top of it. Even the scheduling, like if your appointment's at 9 o'clock, you're going to get in the door at 9 o'clock. And so that says something to me for running a business, running a practice, and that was important for me. So
they're kind of all over it, aren't they, Mom?
They are, and from the very first call, they have a nurse navigator. We didn't know what we needed, and they helped us know what we needed to make sure that Dr. Rosenthal and Dr. Powers had all of Hayden's medical information, and they helped, guide us what's the next steps. And then when we met with Dr. Rosenthal and Dr. Powers, they were so relatable, talked to us, understood that we did not know what was happening. We didn't understand the terminology, and they took the time. They never made us feel like they had somewhere else to be.
The cancer world is a big world, so you probably have a lot of questions, right?
Sure.
Absolutely.
Hayden, what was the treatment process like? Physically, emotionally, what was that like for you?
It was definitely the hardest mentally. Just kind of knowing that you have something that you aren't supposed to have in your body, and you just kind of gotta wait to get surgery done and weigh all your options, like I said. But it's definitely the hardest mentally. But physically, I had a surgery and about a month and a half to 2 months of recovery after that. But physically, it wasn't as hard on my body as I would have thought, and it definitely would have been harder with the radiation if they didn't propose a different solution.
Well, I do want to look at a picture from the operating room. The wound on your arm looks pretty big, kind of like the shape of a football. How did that heal, and how quickly?
It actually healed a lot better than I would have ever thought. They took that much out of my arm, and it just came back perfectly fine. I mean, there's a straight line scar, but everything is completely normal, all range of motion, just nothing really changed.
Dr. Rosenthal, how do you balance removing the cancer while also preserving function in Hayden's arm, especially knowing that he's an athlete?
Yes, that's a very good question, and that's the dilemma of the orthopedic oncologist. Our main goal is to save life, secondary goal to save limb, and we do personalize, and I take very good pride in this, that we personalize the treatment based on the patient, their desires in life, etc. But the second goal is also to preserve function. Okay, what does the patient want to do? How can we do that? And the dichotomy is the guy on my right shoulder, the resectionist, says get rid of every last cell, do as much of a resection as you possibly can, while the guy on my left shoulder is saying, no, save that tissue, save that skin, save that muscle, because I want function. And there has to be a balance, usually referring more towards the guy on the right side of my shoulder who wins out. But most of the time, the vast majority of the time, in fact, well over 95% of cases now, we do in what's called a limb preservation fashion, meaning salvaging the limb in with a good functional outcome.
Well, Hayden, at what point did you start thinking that you might be able to get back to the football field?
When all this was going on, it was really a big question mark. But after the surgery, after I felt how good it actually felt and how quickly it healed, and I had all functionality, like you were talking about in my arm, I was like, I think I can do this. Like, I think I can get right back out there. So.
Emily, were you thinking, no, we've got to get you better? What were the conversations like at home, in the family?
So I definitely, the mom and me, I wanted to keep him close and have eyes on him and protect him and have him in a bubble. But Hayden had other plans, and he's like, I'm made to play football. I've got to do it. And of course we supported him.
Well, on that note, let's bring in Coach. How's that sound? All right. Well, just a reminder, though, before we do that, if you have questions, you can use the chat on YouTube or Facebook. You can email the Medical News Network. The information is there on your screen. So Coach Andrew Rice, Coach Rice, for folks who aren't familiar with the Bulldogs, tell us a little bit about Southwestern Oklahoma State University.
Yeah, we're a Division II school located in the western part of Oklahoma. We're about 40 minutes west of Oklahoma City. Play Division II football in the Great American Conference.
Well, we're glad to have you this morning. Okay, first of all, when you met Hayden and his dad, I mean, does this normally happen? Someone just kind of pops up the way they did?
No, not at all. Hayden's dad had explained the situation, very briefly, actually through Twitter, and said, "Hey, we're going to be stopping by," and so pitched out some time, and then once you're able to sit down and talk with them and spend the day with them, it was really unique going throughout that process. Like I said, it's probably the easiest recruiting trip I've had because they came to us, and it was such I think a genuine and smooth just connection and fit.
Yeah, you don't connect the way you used to. Now it's on social media and
Right.
just a different connection altogether. So you meet, you like the kid, you like his dad, and then this conversation comes up about his health history. What was that conversation like?
It was brought up, and I think from my perspective, when you put, both the medical history and the process that they had gone through, even to be there, both of those stories by themselves could be really remarkable. When you couple them together, as a coach, when you talk about overcoming adversity and putting things in perspective, it makes you like the young man even more, because that with college football there's going to be a lot of adversity, there's a lot of mental toughness that's required of you, and I think it was more so just he checks that box on his resume that when you overcome something, especially medically like he has, that he's definitely got some mental toughness and some determination there.
That's what I was going to say. Yeah, the health issue, wasn't it? Is that the thing that stood out was that mental mindset that he brought that he would bring to the field. I love that. I love that. So Hayden and Jay, was there a point in your cross-country road trip where you maybe started to lose hope? Because you kind of went into this last-ditch effort. Hey, let's just have a father-son road trip. And let's just kind of see what happens.
Yeah, I knew what the kid had physically, how he played ball mentally, where he stood, and I had all the faith in the world for him. But I think at that point, whether he lost hope or not, it was about teaching someone how to never give up. And I wanted to inspire him to never give up on anything in life. And hey, if it didn't work out, it didn't work out. But at least we tried. One last shot. It was one last rodeo. And, he ended up with 3 scholarships when we got back time we got home. And that was great, And I think it taught him something, I hope. So.
Well, for me, the first half of the 26-hour drive, yes, I lost hope. We're driving through, and I'm like, Dad, people don't do this. They don't just show up. And he's like, what are you losing? And I'm like, I don't know, man.
No, this really was played out like a Lifetime movie. I could really see it. Like the dad says, kid, let's go. Get in the car. Let's go. Let's make this happen. And then it actually happens.
Yeah, it was odd, but I mean, it ended up working out, so I can't really give him too much stuff for it.
But I love how you wanted him to get that hope back, because he had sat out football for a year. I mean, the health history was one thing, but it was the fact that he had sat out and maybe missed those opportunities.
Yeah, he definitely did. And he had to go through a lot. That's okay, but he definitely he had some film there, and I believed in it, and I got to watch it and see a little bit of it. And so, I mean, that inspired me, seeing how he played athletically. I think from a mental standpoint, if he got himself in front of a coach and had a coach gave him the opportunity to get to know him, I think that was going to be the changing point.
And that's what you want. You're like, I want my kid to get in front of someone.
Yeah, that's it.
Get to know him, and let's get going. Get back to the sport. What's it like working with Coach Rice and getting back with the team?
Oh, it's awesome. Coach Rice is probably one of the youngest coaches I've ever worked with. and it makes it really easy to connect with him.
Yeah.
And when you see a younger coach, you're like, do they really offer all that they can? And I mean, he's got all the tools that we really need, and the team, they're great. We're on the younger side, but we're growing together, and it's just we're building a great culture. It's
I love
good.
that. Coach, how's he doing?
He's doing great. He's in the thick of a quarterback battle here through spring ball, and one of the great opportunities in Western Oklahoma is the wind will blow. So right before spring break, we had a nice windy practice that he was able to go and handle. So it's been exciting.
Exciting. You're not letting up on him. We like it. It's good stuff. He's not.
He's not.
Jay, you told us that you look up to your son. Explain what you mean.
Yeah, well, he is 6'6", so it's hard not to. But no, I think anybody that goes through what he goes through and is out there willing to inspire. I mean, he's such an inspiration, and I think it's just a natural fit. If you're inspired by someone, it's easy to look up to them, and that's what it is for me.
Emily, how does it make you feel watching Hayden just get back to the field, but just watching this story all unfold as a mother?
So, of course, you always want the best for your kids, and you want them to follow their dreams and be able to and have that opportunity. So to see him be able to overcome this and get right back to college and football and living, his life as a 20-year-old, I couldn't ask for anything more for him.
Dr. Rosenthal, question for you. What advances in surgery and treatment give you hope for the future of sarcoma treatment?
So for me, it's a very exciting field. It's a new field. This didn't exist back 30, 35 years ago when I first started. And I've had the pleasure, the luxury, the privilege of experiencing it and contributing it all the way from prosthetic reconstruction or development to coming up with new techniques and so forth. And even at this time, I'm starting to use newer techniques as well to enhance our ability to salvage the limb and cure the patient of their cancer. And as I said, we are in fact curing most of these cancers, and we're doing it in a personalized fashion and with preservation of limbs so that the patient can undergo whatever type of lifestyle that they would like. So it's exciting for me, and I'll just say it again, as Coach said, my patients inspire me. I want to say, Rudy, you inspire me as well, Hayden.
Love that. That's so great. I want to get to some questions from our viewers, and I will stay with you, Dr. Rosenthal, because Jeremy is asking, is there anything unique about treating a younger patient versus an older patient with the same type of cancers?
So again, we tailor the treatment based on the patient and their lifestyle and so forth. With Hayden, you saw that intraoperative photograph, but we are able to manipulate tissue, to move muscle around, to move skin around, to move even nerves around. Even when we have to do an amputation, we can do certain procedures during that amputation to prevent phantom limb pain. We can construct for the little kids prosthetics or artificial limbs, artificial bones, artificial muscles that will actually grow with the patient as they grow. For a patient like Hayden, who is going to use that arm pretty aggressively, more so than the average person, we're going to do it in such a way that those muscles are going to be stronger. They're not going to be at significant risk of rupture or any kind of damage at all. So it's all tailored to what that patient desires for their life.
Stuart has a question. He says, I hear about immunotherapy and targeted therapy. Do those have a role in sarcoma treatment?
Absolutely. And when I first started, we had 2 chemotherapy drugs and they didn't work very well. Now we have a plethora of immunological agents, molecular targeted agents, and that's where Dr. Powers is involved. And every single patient we present on a weekly basis at our multidisciplinary sarcoma tumor board, which is attended to by over 25 different healthcare workers purely dedicated to the treatment of sarcoma. And we tailor that treatment using the molecular targeted drugs, the immunotherapy drugs, and chemotherapy, radiation techniques, as Hayden pointed out earlier, also how we give radiation, and again, how we're going to do that surgery. And by interacting with ourselves, meaning our own healthcare workers, looking at them in the eye and challenging ourselves, that's how we improve our practice. That's how we improve patient survival, patient function.
Dr. Rosenthal, it's been so great having you with us this morning. What do you want people to take away from this conversation?
Well, the main thing is, as I mentioned earlier, recognition of the problem, especially in the younger person. Younger people don't get lipomas, for example. I mean, they can, but at least they should be seen by a physician. If there's things that just don't feel right, if there's a mass or a bump that grows, and then certainly the go-get-itness, the excitement that the patient imparts to other people in their challenge and their war against this deadly disease really inspires the healthcare workers, myself included, but also the families. And what I found is the families of patients with sarcomas, whether it's the parents or whether it's the children of the parents that have a sarcoma, they do so much better than the average family. And it's always it's always amazing and inspiring to me to see that. So this is exactly that type of example, and I'm very inspired by it.
Thanks, Doc. Coach Rice, so cool to have you with us this morning. We really appreciate you joining our program. What's the big takeaway?
I think for Hayden, it's inspiring, and it goes to, we talk a lot about playing the next play and playing the next rep, and that's all he's done from the discovery to the treatment to overcoming it and getting himself in a position now. He just continues to play the next play and not stay down, and so I love that, and he's going to impact a lot of young people with this story positively, and so he just keep playing the next play, keep playing the next rep.
You bet. Thanks so much. Emily, from a parent's perspective, what's the big takeaway?
Absolutely, just to never give up. Just always rely on your doctors, your medical team. Trust them, trust the process, and just stay the course and keep doing it.
Jay?
That's exactly what I was going to say. Never give up. I think that's what the story's about. If you come across something that is a hurdle you need to overcome in life, that it's just a step in the road, and keep going. Just keep going. Don't give up.
Hayden, I'm going to let you wrap us up today. And what do you want the big takeaway from your story to be? What's the big message here?
I just want people to know that there's going to be things that happen in your life that aren't expected. There's going to be obstacles put in your way. It's all about how you overcome them, because they are obstacles. They are not the rest of your life. It's just how you continue after them and what you do. I was just lucky to be able to find doctors that I could trust at KU, and I'm just glad that I did, because there's no place that I'd rather be than at KU. I did not feel safer anywhere else than I have at KU. Just keep going in life, and like my mom says, you're going to get where you're going.
So glad to have you today. Thanks for sharing your story with us.
Of course.
We really appreciate you so much. Thank you.
Thank you.
Thanks to all of our guests today. Such a great story. Thank you to our viewers for being with us, and we'll see you back here tomorrow. Long COVID has changed so much in Joshua Roman's life, even his music. I'm Jessica Lovell on the next Open Mics with Dr. Stites. A renowned cellist shares how he's adapting and giving back. Plus, an update on research focused on treating the most common symptoms. Wednesday at 8.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.